Hello, and welcome to Discussions with the Director. My name is Dr. Shileste Overton Morris, and I serve as the Chief Program Officer at the Central Susquehanna Intermediate Unit and Director of the Center for Schools and Communities. These discussions give me the opportunity to share with you how our core values connect with our work here at the Center. Our core values include service to others, equity in action, passion for excellence, and innovation for growth. Today's discussion will focus on service to others as we talk about our work to support schools in successfully implementing bullying prevention programs in recognition of Bullying Prevention Month in October. I am so honored today to be speaking with Leah Galkowski, a coordinator with the Center for Safe Schools, which is housed here at CSC. Welcome, Leah.
Thank you, Shileste. It's good to be here.
Leah, you've been with the Center for Safe Schools for almost 24 years. You were one of the very first trainers in the OVEA's bullying prevention program. Tell me how bullying prevention has changed over the past 20 years.
Well, it's changed a lot over the last 20 years, and I'm honored to be working with the OVEA's bullying prevention program for that period of time. The Center for Safe Schools was started after Columbine, as you know, and was the first in the nation to support the implementation of the OVEA's bullying prevention program. We were grateful to have the opportunity to have Dr. Dan Alveus himself come and train us here in central Pennsylvania and work with him until his death in 2020. One of the big differences is we no longer label children as bullies and victims. We know that children move in and out of those roles. So we talk about the behavior so that we're not labeling children, and we're working with them to prevent the behavior from happening in the future, to stop it when we see it happening, and to support all of those children who are involved in bullying. We know a great deal more about the mental and physical health impacts of bullying behavior than we knew 20 years ago. The research has taught us that the impacts from bullying behavior last well into adulthood.
You talked a little bit about how social media was not a factor in bullying. Can you talk a little bit about how it has influenced bullying today?
Absolutely. One of the things that we know from the research involved in cyberbullying behavior is that there's no escape from it. Children, when they go home from school, they don't experience the in-person bullying that they may have experienced in school. But when they go home, now they're on their device, on their computer, and the cyberbullying has access to them 24 hours, 7 days a week. Before, they had the opportunity to escape from the bullying behavior. Now they don't. However, one of the myths associated with bullying behavior is that cyberbullying is the most significant part of bullying behavior, and it's not. The research still tells us that the majority of bullying happens face-to-face in those places where students gather. School, after-school events, community youth organizations, parks, recreational activities, all of those places. The majority of bullying behavior happens face-to-face.
That's a very interesting fact. I think as parents and educators, we see how connected young people are to their phones or other technology. And so that's very surprising that cyberbullying is not as big of an issue as it is in person. So thank you for sharing that. Can you tell us a little bit how schools are handling physical or other behavioral issues when kids are being bullied?
Well, every state in the nation has a bullying prevention law or policy that must be implemented in schools. In Pennsylvania, every school in the state must have a bullying prevention policy and educational component. It is suggested that they have an evidence-based program to address bullying behavior, but they must have a policy. It must be posted in every classroom, in every common area, on their website, and in their student handbooks.
Good. So parents or other community members can go to their school's website or ask for a handbook and find out what the bullying policy is for that particular school.
Yes, and actually parent involvement is one of the best practices. We want our parents and caregivers to be involved in the process of reporting bullying behavior and addressing it from the get-go. Don't wait until something happens. We encourage our parents and our community members to be involved in the process of preventing bullying behavior as opposed to addressing it after it happens. One of the other things we know that's a best practice in bullying behavior is it's handled very differently than a conflict. We know that best intentions back in the day were to handle bullying the same way that we would conflict. Get the two students together, have them apologize, and work out their differences. What we know from bullying behavior is that there's a power imbalance. And when we put those two students together, we're providing the opportunity for the child who's been bullied to be victimized again. So we want to make sure that we handle bullying behavior very differently than we do conflict. We want to make sure that the child who's been bullied is protected. We want to make sure that bystanders are addressed, that they know that this behavior is not okay. If a bystander stood up, we want to, commend that behavior and support that behavior in the future. But we also want to address the child who's doing the bullying. We want to make sure that they know that those behaviors are not acceptable in our learning spaces. And we want to make sure that they make better choices in the future.
I know a lot of schools are exploring restorative practices. Is that a way for schools to address bullying after it's happened?
Restorative practices are a evidence-based, proven effective approach to building school climate and addressing problem behaviors in the building. What we know from bullying behavior is that for a restorative circle, which is the part where all the parties come together and talk about the harm that's been caused. What we know for that to be effective in a bullying situation is everybody has to be comfortable with the situation. The child who's been bullied has to understand what all the possibilities are that might happen in that circle. The child who's done the bullying has to show remorse and must also understand what the limitations are of that circle. So it's our recommendation that that type of restorative circle only happens by people who have been very well trained in the process, have experience with the situation, and all parties are on the same page.
You talked about reporting and how all schools are mandated to report bullying incidents. Can you just give us a general idea about how that happens at the school district level, what parents or educators can do to report bullying incidents so that these numbers are accurate? Because I know accuracy has been an issue in the past.
Yes. So what we encourage parents, caregivers, community members to do is understand the school's policy on reporting. In every policy in Pennsylvania, it has to be listed who takes those reports. So if you know ahead of time who takes those reports, you can contact the school district and contact that person. We also want the child who's been involved in the circumstances, either the child who's been bullied or a bystander, to tell an adult at school and an adult at home. So that adult at home knows what their process is ahead of time before an incident happens. We want caregivers and parents to know that there are resources available to them so when that they talk to their students, whether their child has been bullied, whether their child has witnessed bullying, or even if their child has done the bullying, there are resources available to them to help them talk with their students, with their children. We have a wealth of resources on our own website, centerforsafeschools.org, and the federal website also has some really good resources, stopbullying.gov.
So Leah, I would be remiss not to acknowledge the fact that we started together in this work. As you said, right after Columbine, both of us as Safe Schools coordinators. And I have to say, I am so very thankful and grateful that you are on our team at the Center for Safe Schools, continuing in this work, one of the most highly requested, knowledgeable experts in the field of bullying prevention. And again, just grateful for all that you bring to the work. So can you tell me about the guidance and support that the Center for Safe Schools, as well as the Center for Schools and Communities, can offer to schools to help families involved in bullying prevention activities and or bullying intervention activities?
Yes, and I want to say thank you, Shileste, for your kind words. It has been an honor and a privilege to go through this journey with you here at the Center. The Center for Safe Schools is a part of the Center for Schools and Communities, and we have access to many resources, including some of the other initiatives like the Center for the Promotion of Social Emotional Learning and our Family Support Team. We all work well together in bringing an array of services to schools. One of those services that we can offer at the Center for Safe Schools is training and implementation support in the Alveus Bullying Prevention Program. That is the most evidence-based, researched bullying prevention program that we know about. I am a certified trainer in that program, as you mentioned earlier, and I've been involved and working with that program since 2001 when it was first brought to Pennsylvania and the U.S. The other thing that we can do is just talk about best practices in bullying prevention, provide professional development opportunities for school districts, for community youth organizations, for parent organizations, any of those interested parties in supporting the best outcomes for children and youth and their families. The other things that we can do at the Center for Safe Schools, of course, are around school climate improvement. We can do behavioral health and climate assessments and physical safety assessments also. There's an array of opportunities for us to support schools in implementing and supporting those safe, welcome, inclusive learning environments for all students and staff.
Well, thank you again, Leah. I think it's important for our listeners to also know that the Center for Safe Schools was one of 42, I believe, nationally recognized centers for safe schools in the country. And again, the work that you and the rest of your team have been able to do around school climate, school safety assessments, and supporting schools in really creating not just a physically safe environment, but also a psychologically safe environment. It's been tremendous work and growth to see schools who hadn't even considered implementing strategies to reduce that physical violence and or again the psychological violence actually engaged in strategies to help students and families and communities. I hope you learn more about the Center for Schools and Communities and how we live our values each and every day. Please visit our website found on the screen below, and we look forward to seeing you next month.